All right, so that's enough about me, though. I want to get to know you guys a little bit. So, who in here is a student? Students, could you stand up, please? Or interns. Students or interns, stand up. Good, nice, good selection. All right, now if you already have a job lined up after internship, sit down. You already have a place to work. It's all set to go. Some people were unsure of that. You might want to figure that out. Okay, so of those still standing who do not have a job yet, how many of you look at the AMTA job listings website and have a little bit? Oh yeah, go ahead, raise your hands. You all look, okay. How many of you have a miniature heart attack when you look at that? Good. Either because there's not many jobs in your area, or they're not the jobs you're looking for, or maybe no jobs in your area. It's a little nerve-wracking, right? Good. Okay, you guys can sit down. Thank you for being good sports. Give them a hand. Give them your support. All right, how many of you work in private practice? You guys don't have to stand up. You're old, so you don't have to... how many of you in private... Raise your hand, private practice people. How many would you like more contracts, more referrals, more clients, bigger practice? Only 2 people, okay. Oh, 3 people, okay. So the rest of them are happy where they are. That's good. All right, well, then this presentation is for you too, because I'm going to tell you why this area is a really good area to focus in. So we're going to talk about the changing healthcare landscape and how that's really, really good news for music therapists, especially music therapists with entrepreneurial mindsets. So if you work in healthcare, you might know that healthcare is changing, and dramatically. We're seeing a big shift from the disease-centered approach to the client or patient-centered focus. And this means 3 big things. Number 1, it means gone are the days of the family physician where you walk in, any problem you had, you went to your family doctor, and he would get you right, give you all the medicine you need, and take care of you from start to finish. That's everything you had. He knew you for your whole life. That's gone. We're seeing much more of a team-based approach and a lot more specialization. So you might have your primary care physician, of course, but if you go in and he tells you you have a heart problem, you're going to go to a heart specialist who's going to prescribe you some specialized heart medicine. You might have a nutritionist on your health team who's going to make a specialized diet for you, a heart-healthy diet. You're going to have maybe a personal trainer that works with your healthcare team to make a workout regimen for you to help get you back in shape. Maybe a case manager if you're having, or a social worker. If you're having trouble, you can't work and you can't pay your bills anymore, a social worker can help you make a plan of action there. Perhaps a patient advocate to help you deal with the insurance companies. You have this giant team working for you. Now, the other big shift related with this is that we're not so, or doctors, we hear a lot about bedside manner, patient satisfaction. That's become the new focus in healthcare. They're not just worried about just looking at that disease, curing it, and kicking you out the door. They want to take a very holistic approach and care for you in every aspect, every need you have. And the third thing we're seeing, a big change in healthcare as a result of this, is a lot more competition. In fact, in a 6-month period from 2010 to 2011, so I think this was January to June of each of those years, healthcare spenders, or healthcare providers, increased their spending on marketing by 20.4%. That's a lot of money. Hospitals are spending a lot of money to market. You probably see this every day when you're driving around town. How many times do you see billboards for hospitals? All the time. What are they advertising? They're saying, here's our hospital. Emergency wait room times. Yes, we have the shortest ER wait time. We have these specialists. Hear this person's story. They brand themselves. They have their logo, everything. They have slogans. This is very, very important to them. Why do you advertise anything? Bring in business. Do you need to advertise if you're the only game in town?
Nope.
Not really. So there's a lot more people around fighting for these patients. Approximately 2 new urgent care centers a week open in the United States. And in 2007, they numbered between 12,000 and 20,000. That's a lot. What is the big selling point of an urgent care center? Why is it important? Open on the weekends. It's convenient. It's fast. You don't have to make an appointment. You can walk in when you need to. Convenience is another big thing that healthcare marketers are pushing for. So now more than ever, healthcare providers are competing for patients. And as a result, patients have more choice than they've ever had before in healthcare providers. Now let's talk a little bit about healthcare spending. Do you know that 50% of the U.S. population lives with a chronic health condition? Half the people in this room, perhaps at some point in their life, will have a chronic healthcare condition. And of healthcare spending, 40 to 70% of all healthcare spending is spent on these chronic, persistent health conditions. So the majority of the spending is coming from people who are making a lot of trips to hospitals and healthcare centers. This is not just the person coming in every so often, maybe with a routine health problem. They're coming in all the time and spending a lot of that money that's driving the healthcare industry. So if you have somebody who's coming in a lot, wouldn't you want them coming back to your hospital for all their needs, or your healthcare center? That makes sense. Yes?
So are the chronic healthcare patients spending this money, or the healthcare providers are spending that much money on that?
The amount of healthcare spending in the U.S., people spending money on providers, is coming from chronic health conditions. So basically what we're saying is healthcare providers are jockeying for position. They're all trying to tell you why they do this better than the other one, why their healthcare center is better than the other one in town, and why you need to go to them when you have a problem. Now let's talk a little bit about consumer behavior. I know sometimes it feels a little cold and harsh to talk about healthcare in terms of consumer behavior, but it's just reality. You have a budget that you spend on your health, and you have choices to make when you're spending that budget. Like it or not, there is a transaction happening. Agreed? Most of the time? Okay. So research suggests that while price is a major factor in consumer decisions, it's not necessarily the primary factor. In fact, the primary factor is the quality of the goods or services being purchased. And you can see this in your everyday lives. I bet everybody in this room probably is not driving the cheapest car they could have possibly found on the market. It probably was a balance between price and quality. You could have gone out and found a hunk of junk 1970-something Pinto, and that's probably not the choice you made. You probably went, well, I can spend a little more and get the Honda that's going to be a little more reliable, something like that. I drive a Volkswagen. They're not reliable, so I made the wrong decision there. And then let's look at a few major big-ticket items. Whoops, going too fast here. There we go. The iPod. Clearly not the cheapest MP3 player in the market, but it was the most popular by far, and it put other MP3 players out of business because it was conceived as a higher quality product and provided a better ease of use for the buyer. But it wasn't the cheapest. We also see it with necessities in everyday life, like food. That's why Whole Foods is exploding. It's not the cheapest grocery store in the market, but there's a perceived higher quality there. Organically raised food, chemical-free. This is very important to people, and they're willing to spend more money on that. And room for old musicians, I'm sure, can appreciate the beauty of an Epiphone Les Paul. We all have a budget. We would all love one of those, but it's definitely not the cheapest electric guitar on the market. And this behavior carries over into healthcare, which makes a lot of sense. Your health is one of the most important things to you. Isn't quality very, very important to you? Let's look at a little bit about brand loyalty. I've highlighted 3 major companies here, and quality drives consumer loyalty. And consumer loyalty is important because people keep coming back to that particular company for the services they need. They evangelize on behalf of that company. They go out and tell all their friends, you got to use this product, you got to go to this hospital, you got to use this. They were great, they were fantastic, and we know that peer review is extremely important for today's consumer. They are all about what their friends and peers say about a product or service. And they're also more forgiving of minor flubs by the company. So if there's a brand that you love, a company you love, a hospital you love, and they make one mistake, you're more willing to kind of say, I've had such a good track record with them, I'm willing to let it slide. So I highlighted 3 companies here, Apple, Amazon, and Toyota. These are pulled from Forbes' top 10 companies with the highest brand loyalty in the United States. Apple is a pretty obvious one. They built an entire persona, a stereotype around the Apple user that other companies try to attack, to advertise against them. You know, the ads with the Apple geeks standing in line outside, and they're talking to each other about, oh, the headphone jack's on the bottom now. And Apple loves this. They built a personality around it. That's good for them. There is an identity there. And these people fanatically come back for every single product. I made the transition myself in the last year. I was all PC, and I kept hearing from all my Apple friends about how great these products were and how you had to switch, blah, blah. And so I finally got an iPod. I was like, wow, this is really great. And then I got an iPhone. I was like, this is the best phone I've ever had. And then I made the big purchase and got the MacBook Pro. I love it so very much. And now I have an iPad. I have my entire little array there. And so they successfully switched me over because of this brand loyalty idea. I fully admit I was a sucker for their marketing. I bought in, and I'm so happy I did. Then we have Amazon. Everybody uses Amazon for their products and services. The Kindle Fire is very popular. They're kind of the king of balancing product and price. And their services are very, very convenient, so people go back and buy things off Amazon over and over and over again, and they consistently deliver on their promise of good service. Toyota is one of the highest consumer loyalty car brands because they consistently offer a high-quality product that is a good price and high quality. And so people know when they buy a Toyota, they're getting a good product. And they play on this in their ads too. They say, I just bought the 2014 Camry, my husband drives the 2004, and our son drives the 1994, and this one has the 1984. And they talk about how many Toyota Camrys are still on the road today from 30 years ago. So it's all about having these people view you in a positive light and be advocates, basically, for what you do. Now, brand loyalty is responsible for 70% of all purchase decisions, and consumers are willing to spend an average of 20% more on the brand they prefer. So again, price is not the end-all, be-all of product or services. And if you're a music therapist, this is good news, really good news, and this should make you really, really excited. And I'm going to tell you why. Here's what we know about patient satisfaction in healthcare settings. We know that service improvement measures in hospitals and healthcare settings have increased perceived value. So even if the price is higher, people perceive that they're getting a better service and it's worth it. In outcome, in actual health outcomes, in quality, and in likelihood to recommend, which I've highlighted. They're going to tell their friends, this hospital was fantastic to me. Providers who provide more personal care are associated with higher levels of patient satisfaction. And patient satisfaction has been tied to autonomy and choice in healthcare decisions, as well as perceived friendliness and personality matched with providers. And if you have a music therapist brain, you start to see where I'm getting at here. As I said before, there's even research that suggests that these improve health outcomes. So this is not just about a money thing. This is about making people healthier as a result of providing these higher quality services. The fact that a cleaner, prettier, better food in a healthcare setting could actually provide improved outcomes for people going through a disease or a chronic health condition. So we're looking at convenience, cost-effectiveness, patient-centered, and patient satisfaction when we're talking about where healthcare is moving. Now, the point of this presentation. Let's get to the Pediatric Interdisciplinary Clinic. Now, this was kind of a term that I kind of had to make up because there's not a unifying terminology for this. A Pediatric Interdisciplinary Clinic, by my definition, is a clinic that provides services for clients who are primarily 18 years old or younger, pediatric. Interdisciplinary meaning they offer at least two or more services that are continuing rehab services, things like physical therapy, speech-language pathology, occupational therapy, something where people are coming back over and over and over again, typically on a weekly basis. And it's in a clinical setting, not a home-based therapy. So that's what I'm defining as the Pediatric Interdisciplinary Clinic. Now, is this convenient for people? Yeah, convenient. Do you think it's more cost-effective? Probably, yeah. If all these people are sharing one roof, it's more cost-effective for parents, certainly not to drive all over town to all these different clinics. So this is a big area that hits, or these clinics really hit on all these things that healthcare is moving towards. And we know that this area, or the need for these clinics is expanding and rapidly. In fact, in a 12-year period, developmental disability rates in children have risen from 12.84% to 15.04% in the last 12 years. One of the big causes of that, of course, is autism spectrum disorders, which went from a rate of 1 in 150 in 2000 to 1 in 88, according to the most recent numbers, and actually, that's not even accurate anymore. The newest CDC, I don't know if you saw this just yesterday, I think, released a new study that pegged the number at 1 in 50 school-age children with autism spectrum disorder. That's a lot.